Hello, my name is Raquel Williams, and this presentation is for integration of genetics and genomics into ethical nursing practice. It is the Module 5 written assignment entitled Genetic Disorder Presentation of Turner Syndrome. It is being presented on August 11, 2020 for Sarah Shanks. This presentation will explore the definition of Turner syndrome, how Turner syndrome presents in patients, as well as possible genetic testing for Turner syndrome. To begin with the definition, Turner syndrome is a genetic circumstance in which a female is missing an X sex chromosome either completely or partially. The condition is diagnosed prenatally, in infancy, or in early years of childhood. Rarely, Turner syndrome can be diagnosed in teenagers and early adulthood. Turner syndrome presents in patients in the following ways. In utero fetuses, Turner syndrome presents as edema or abundant fluid accumulation primarily of the posterior neck. It could also include irregular heart development and irregular kidney development. Turner syndrome presents in newborns and infancy as a wide web-like neck, abnormally low ear placement, wide chest and outward turning nipples, high and narrow palate, outward turning arms beginning at the elbows, upward turned nail beds, swollen hands and feet, immature birth length, delayed growth, heart deficits, low posterior cranial hairline, abnormally reduced jawline, and receded fingers and toes. Turner syndrome presents in children, teens, and young adults as delayed growth, no milestone growth spurts, significant height deficits, inability to develop sexual maturity during adolescence, premature end to menses, and inability to conceive without fertility assistance. Possible genetic testing for Turner syndrome includes choroionic villi sampling, which is prenatal sampling of the placenta, amniocentesis, which is a prenatal sample of amniotic fluid, sonogram and ultrasound evaluation, and karyotype blood testing. I've also prepared a pedigree of the Turner syndrome as it presents in 3 generations. And this concludes the Module 5 written assignment presentation.